Miss this up-and-coming interactive television event, The COVID Conversations, where you'll be able to get all the information on Delaware's rollout of the COVID-19 vaccine. So tune in to DETV for The COVID Conversations on Wednesday, April 14th at 6 p.m. COVID-19 stops with you. Visit de.gov/COVID vaccine for COVID-19 updates. Back to this episode of One-on-One with Ivan Thomas. I'm your host, and today is an amazing show. I have something, we like to call it diamond in the rough, something that you don't see too much on TV, but you see it here first on DETV. And I'm proud to introduce two young Black residents from St. Francis Hospital that are making their ways through Wilmington, through Delaware, but they're doing it in a way, just a way of just hope, gratefulness, peace, unity, love. Sound like an old African Bambaataa song. You know what I mean? But the idea that these two young guys had is just phenomenal. And they're starting here in Wilmington. So I want to introduce you to some and reintroduce you to others. Did I say that right? I said that like totally wrong. But anyway, I want to introduce you all to Abasi Bomani, resident at St. Francis, and Naim Quail also. Welcome, guys.
Hey, thank you for having us.
Okay, first of all, you guys, let me say thank you for what you guys been doing. Now, okay, we got that out the way. I'm not even gonna use the word Black. Young residents. Yeah. What made you both? What inspired you to become residents? I'll let you go first.
Okay, yeah. So that's an interesting question because there was no big story for me. I always wanted. I think it was fifth grade. I said I'm gonna be a doctor, and then from then on, I just kind of went with it. And I kind of just stuck to my guns, and I just went for it. And ever since then, I've been on that path. So I went to Howard University. That's where I met Abasi.
Okay.
And we did. I met him at this pre-medical. It was actually before. Before Howard started, we did a pre-medical program at Howard. What was it called? HCOP? HCOP. So I met Abasi at HCOP, and it's for people who want to be, for students who want to be future doctors.
Okay.
And then, I majored in biology first and sports medicine, and then I just went, it was there's no story for me. It's just, right. I want to be a doctor. So
and you knew it from gate.
I knew it. And I can't tell you why. I can't really tell you what influenced me. It's just that was I know I love science. I love the human body, and that was always my interest. Mm-hmm. So that's the path I just kind of stuck on and went for it.
Any family members
no
that are doctors?
No, I don't have any doctors in my family at all.
First doctor in the family?
Yeah, first doctor.
Congratulations.
Thank you.
How about you?
Kind of the same story. I think when my sisters would tell me, would ask me what I want to be when I'm older, I'd say a doctor. I don't remember any of that.
Right.
But my mom is an RN.
Okay.
She's been a bedside nurse for like 30 years.
Okay.
She comes home and she's very satisfied.
Wow.
I can tell she's very fulfilled in what she does. And I think that I wanted to do something that involved the human condition.
Okay.
And then when I was in high school, I think I was like a junior year, my dad said, "Which one, son, doctor or lawyer?"
Wow.
And I said, "Well, I won't be a lawyer.
Right.
So I'll be a doctor." Yeah.
Wow.
So I think it all just kind of fit that way.
That's amazing. That is amazing.
Yeah.
So you guys are making your way through Wilmington. You had this wonderful, I like to say my ideas are crazy. I start all my conversation. I got this crazy idea. But your idea is not crazy and not far-fetched at all. It's something that's on your hearts to do as young Black men going back into the community. And it's the barbershop. You're going to the barbershop. Yeah. Can you explain a little bit about that?
I'll let him start actually because he gave me the idea initially, so I'll let him start.
I don't believe ideas are ours. I think we download them from somewhere else.
There you go.
Right? You know. But the idea was that we want to break down barriers to care. There are a lot of barriers that we have. As patients in general, there's a lot of barriers. But then when you get to certain communities, communities that have been marginalized, oppressed, have lack of access to care, have, inequities in health outcomes. We want to break down those barriers so we can actually change some of that.
Right.
So to break down some of those barriers, we need to figure out how, where to set up or how to reach people. Barbershops traditionally for Black men, I think are a safe haven.
Yeah.
We have intimate conversations. We have raw conversations. We have political conversations. We can be ourselves without being judged by the outside world,
Absolutely.
And because of that, I think we can be vulnerable, and
Right.
vulnerability can lead to new understanding, can lead to opportunity. So I think that, setting up at a barbershop and screening for, these things like blood pressure, cholesterol, diabetes, which are killers for us.
Yeah.
And especially Black men from the ages of 45 to 64.
Yeah.
The number one killer is heart disease.
Yeah.
After that is cancer, accidental, causes, diabetes and stroke. So a lot of the things are preventable.
And I think, and I know, excuse me for cutting you off. I think as Black men, I'm 45, right?
Yeah.
And I think as Black men, we just overlook it and think we're invincible.
Yeah.
You know,
Absolutely.
And and then something happens, and then we're like, oh shoot, I need to go get checked out.
Sure.
Do you see that a lot as residents and soon to be doctors?
Yeah, a lot of times the patients that most of my Black male patients come in when they have a problem. It's very far few in between when I get one who's coming in for preventative care. I do have some.
Yeah.
Most of those men have wives though, So
Wives saying,
they're
"Go
with
get
them there,
checked."
like,
so-
you need to come. Yeah.
So yeah, we do have those. And to add to his point, more than any other demographic, Black men are less likely to seek medical care.
Yeah.
Definitely for preventative causes. I mean, for preventative reasons. They're more likely to die from chronic diseases like heart disease, diabetes, and strokes. More likely they have a lower life expectancy than any other demographic. And that's why we want to target this population, because there's a gap, there's a health gap, and we need to close that. And this is one way we can. There's many avenues to close this gap. And there's many reasons why this gap exists. We can go into that.
Oh, that's a whole nother
That's
show.
a whole other show,
Yeah.
historical context
show,
and whatnot.
absolutely.
But our point was let's do what we can at this point in our lives. What can we do to help close this gap?
Yeah.
And this was what we decided that it was the best way for us.
You said you said chronic illness.
Yeah.
But also preventative. Like we can stop this.
Absolutely.
Now,
Yeah.
high blood pressure.
Yeah.
What are some symptoms that somebody might be watching right now with their wives, right, or just by themselves on their couch?
Yeah.
What are some of the symptoms of like high blood pressure?
Well, blood pressure is actually a silent killer.
Yeah.
A lot of times it goes unchecked. So
Okay.
a lot of times there are no symptoms. But when there are symptoms, that means it's really bad.
Okay.
And
what are those symptoms?
So it can be headaches, blurry visions,
Mm-hmm.
can have high blood pressures. You can get chest pains from high blood pressures.
Mm-hmm.
The worst outcomes from high blood pressure are going to be strokes,
Mm-hmm.
heart attacks. So all those things, like high blood pressure can lead to all those things. But like you said, like our goal is to prevent those outcomes. So that's what we do. But most of the time, high blood pressure is asymptomatic. We have people come in with very, very high blood pressures and no symptoms at all.
Wow.
You just find it incidentally.
Okay.
And that's why we do these screenings, right?
Right.
So we can prevent people from getting worse,
Right.
or regress what they already have. So I think that's why this is important.
Yeah. Yeah.
So-
Definitely. Hypertension.
Yeah.
Was another killer.
Diabetes.
Oh gosh, that's the whole.
Yeah,
I remember a friend of mine said one thing that you don't want to be as a Black man is be diabetic.
Yeah.
It's like it's suffering slowly. The first
Absolutely.
thing is they cut your toe off. The next thing they cut
Yeah.
your foot off, and all that. But that's something that could be cured or be healed with diet.
Yeah.
You guys are
Absolutely.
plant based,
Yeah.
right?
Yeah.
Yeah,
100%.
Has that helped you in your lives being plant based?
Yeah, absolutely. I think we both went plant-based around the same time.
Mhm.
And so we're young men, so, we probably are very resilient, but I definitely see just a generalized, I feel better,
Okay.
and just eating, I feel better. And I think that as a physician, my walk is always, practice what you preach.
Right now.
Same.
So,
Yeah.
when you talk to a patient, I think when you come off more genuine when you're actually walking the walk.
Yep.
Yeah, you can't smoke a
then-
cigarette and say
Yeah.
stop smoking.
Or so you can't say eat more fruits and vegetables and eat more fruits and
Yeah,
vegetables.
and you
that
don't know
happens
what
all
to
the
tell
time.
them.
You know,
Yeah,
Yeah.
exactly.
all the time.
Yeah. And medical doctors, and specifically in medical school, we don't get much training on,
Yeah, absolutely.
diet.
Wow.
or or healthy foods or any kind of nutrition for that matter. So, I think that's something that needs to be mitigated, or at least physicians need to seek that out themselves, because no, we don't want to put patients on medications their whole life. I think my idea is to give a patient their own agency and autonomy, so they can be their own, healthcare proxy, and they could take charge of their life.
Right. Right. This whole thing is real. You find cats like me that spend a good amount of their time working, and sometimes we don't get a lot of time to exercise or to eat healthy. The foods in our area. And before we even started today, you were talking about you're from the Bay Area, and you're from
Upland, California.
Yeah, Upland, California, and
close to Rancho Cucamonga.
Yeah. But it's different. You have the resources that can support a plant-based diet versus here. They are the food deserts, and there are inequities and when it comes to just nutrition here,
So one thing I will say is that our clinic, shout out to St. Francis.
Oh, shout out to St.
Shout
Francis.
out to St. Francis residency. Shout out to Lillian, who is our dear friend and medical assistant there, who does a lot of work and is very excellent at her job. And everything she's done, a tremendous job of orchestrating these barbershop events, talking, getting things prepared. So
this doesn't happen without her. By the way.
Absolutely not. Absolutely not.
Yeah, great, crazy shout out to St. Francis. St. Francis has been around this community forever. My dad would if I get sick, just take me to St. Francis. And one thing I love about St. Francis is how they pray in the morning.
They do.
And they got the best ice
on the intercom every morning.
Every morning they pray.
You don't know if it's a cold blue or a prayer.
Right.
That's true.
But no, shout out to St. Francis. Barbershops. How many barbershops are you going to on the 24th? 24th of April.
Yeah,
I got that right.
Yeah.
Well, I don't have to play that number.
So we're just doing one event at a time. So this is going to be the first one at New Creations Barbershop in 287, I believe, Newcastle, Delaware.
Okay.
So it's going to be one event 9 to 1.
Okay.
And we'll be there just screening for diabetes, high blood pressure, high cholesterol, which is another silent killer. It adds to the hypertension aspect, and obesity. Again, we didn't talk about obesity, but that's a huge one as well.
They all ride together.
They all ride
Yeah,
together. That's 100% true. They all ride together. So we're going to be screening for these common things that we see. These are the bread and butter of medicine. Preventative medicine, I should say. And catching these things early can prevent a whole host of problems later in life.
I'm just thinking about the quote, "Food is thy medicine." Right. But also, food can kill you.
Hippocrates. That's what he said.
Hippocrates.
Let that food be thy medicine, the medicine thy food.
Yeah. And so I want you to touch a little bit more on what is high cholesterol, because a lot of people might not know. They might not even know how they're getting this high cholesterol. So can you explain what is high cholesterol? What is where did diabetes come from? What causes these illnesses?
I'll let you.
Sure. Well, for cholesterol, our body doesn't need extra cholesterol. Our body makes cholesterol. Where most of the cholesterol in foods comes from are high fatty foods and processed foods. Those high fatty foods are typically animal protein, and then other processed foods, which we eat a lot of as Americans. Those TV dinners, all those which are high salt, high saturated fat, and they tend to go in the body. And then so we typically delineate the cholesterol from being bad and good cholesterol. Very simply, LDL is the cholesterol. It's really a protein which deposits cholesterol in the arteries, right? So you deposit in the arteries, it's just like a freeway. If a lot of cars jammed up, it keeps blood from getting through, right? So, and then HDL is the good one, because HDL is the I guess the tractor or whatever is taking cars from the highway, taking the cholesterol from the highway. So, I mean, from that simple model, cholesterol is like Dr. Quail said, is a silent killer, because, it gets to the walls, it oxidizes, it creates vessel narrowing, and it creates the risk for having, heart disease, and then having a heart attack or having a stroke. Those are some of the things that we're dying from, which are rampant.
And the stroke and the heart attack is the cause, the effects after. It's high blood pressure, stroke.
But like you said, what happens a lot of the times, there's one theory is that the high blood pressure actually damages the arteries, and the body sends cholesterol there to kind of almost like a patch the arteries up.
Gotcha.
And then when like he says, cholesterol doesn't belong in the arteries. So when it does, it creates an inflammatory reaction, which is oxidation and all these other whole host of issues, and then that creates a plaque, and that plaque gets bigger and bigger and bigger over time. So it is a huge risk factor for cardiovascular disease. You will actually have some people argue that it's not, but I think most cardiologists will say that it is.
Absolutely.
Right.
And they specialize in this area. So it is a huge risk factor for like you said, strokes, heart attacks, and everything else. So diabetes, to answer that question, diabetes, if you look at the research, they'll say, we don't know the etiology. There's multiple theories as the etiology, but and what's going on with diabetes is you have sugar that cannot get into the cells. So sugar belongs in the cells because it provides the muscle cells and other cells in the body energy. It helps to produce energy. But if you have diabetes, you have what's called insulin resistance. So your pancreas is an organ in your body that releases insulin. This insulin allows the sugar in your blood to get into your cells to create energy. But if you are obese or you have certain other risk factors, family history or whatever, you are insulin resistant, which means that like insulin is like the key that lets the glucose into the cell. But if there's resistance to that insulin, the insulin will bind to the receptors, but glucose still can't get in because it's resistant.
Right.
So the glucose will stay in the bloodstream. And anytime you have a lot of glucose in the bloodstream, is toxic. It damages your eyes, damages your kidneys, damages the nerves, the vessels. So it high glucose is in the blood is not good, and that's what diabetes essentially is.
Right.
So you have your arguments as to what causes it. Like I can tell you a whole bunch of reasons, but I can tell you what helps prevent it and what helps. I can tell you what actually works in terms of reducing your I don't want to say cure, but reversing those effects. It are food and exercise are a huge part in preventing these diseases. Like you said, there is a social determinants of health we have to talk about as well, because that makes it hard for certain people to have access to healthy foods. And maybe don't have access to the education and all that. That's why I think it's important for people like us to go out into the community and show, like, look, we're here. We actually care. You know, we want to help. So, but
and I agree, and I think it's enough to have the tools, right? But if you don't know how to use the tools, then there's no point. So we need the tools, and we need the exposure, and we need the access. So, and I think that's what we're trying to provide, the access, and then also the teaching.
Exactly.
And, and the education, which is,
education is key.
It's very key.
And I think a lot of patients don't even know what is going on. Like I think education. Some patients will come and you tell them they have diabetes, they had no idea, and they're urgent to change. They don't even want meds. They're like, what can I do other than this? You know what I mean? But then you also have that patient who doesn't want to change, doesn't want to do anything.
I'm cool.
But, I'm cool.
Smokes a little bit.
But that's what we're here for. I'm a very patient person. I will wait for you. I will wait for you for years until you're ready. You know.
You ready, Mr. John? You ready, Mr. John?
Not yet. Okay. Well, I'll see you.
Hop over here. I get it.
So I'll wait for you for a while, your lifetime, as long as it takes. So I think being patient is key, but I think, we have to really address this in a way where medication helps. It definitely helps, and there's a place for it. But I think that a lot of times as physicians, we don't emphasize the lifestyle like we should. And if we did, I think we can make a huge change, because I've had successes doing that. And part of that is why this project is so important, because Black men are a lot of times resistant. But if there's a doctor that looks like you, there's actually a study done on this in Oakland, California, that Black men who were being treated by other Black physicians were more willing to change, because you speak the same language.
Exactly.
You have the same experience.
Exactly.
So, and that's with any race, right? Indian going to an Indian doctor, whatever. You're gonna have some sort of connection already. And I tend to have a lot of success with my Black male patients, because they understand where I'm coming from, and I understand where they're coming from.
That's exactly what I was about to ask you, is how is it that when you go into the room and they see you and they're like, oh, okay,
you could be my son. That's what I always hear.
You're my son.
Are you sure you're my doctor?
and they treat you totally. They receive what you're saying.
A lot of times that's the case.
Absolutely. Absolutely. It's like that response, like, oh wow, I didn't know this existed, They get real late. Doc.
Right.
And then like Dr. Quail said, it's like, they're very open to suggestion. They're way more open to suggestion. They're like, oh, okay, so what should I be doing for this?
Have you seen a good amount of success with patients that's coming in to see you?
Absolutely. Patients with with diabetes, with high hemoglobin A1C numbers, and just say hemoglobin A1C is just a measure of how we kind of see how your diabetes is doing.
Right.
Basically, red blood cells, have a lifespan of 3 months. Like Dr. Quail said, there's a lot of sugar in the bloodstream with diabetes, so we can tell how well you're doing or how much sugar is in your bloodstream by the measurement of the hemoglobin A1C, which is the glucose coating the red blood cells.
Right.
So we can measure that. So I've had patients with high hemoglobin A1Cs, and because we speak the same language, and I'm telling them, and being real with them, like, these are the effects.
Yeah.
Your eyes, your heart, your sexual drive, your ability to be potent, and I think that we can get through because we speak the same language.
You said
like
sexual drive.
Yeah.
All right. So that is one of the indicators of high blood pressure.
It's actually one of the first indicators of heart disease as well.
Is it?
Yeah.
Absolutely.
It's an early marker for like heart disease. So people who are 45 males and they have, that's a good indicator. Like, look, you will have heart disease later in life.
Yeah. So if you're watching and you're 45 years old and your man and Mr. Johnson ain't showing up,
think about going
to see the doctors at St. Francis.
Yes, absolutely.
Wow, this is some awesome information. This is tough. Has there ever been a time that patients didn't want to listen to you because they thought they was young? You were too young?
Yeah, for sure.
Yeah. Well, I think they comment on how young you are,
right?
And you say, okay, let's get to business.
Okay.
And then I think that generally people respect you because they realize what it takes to become a doctor.
I'm gonna tell you, I'm fascinated. I'm sitting here blown away. I'm not even gonna lie. I'm not even gonna hold you on that. No cap. It's just I got 2 young black doctors that look like me, and so I can imagine when you guys hit the street what people are going to say, or even just like when kids come in here to the TV station, right? They don't expect to see me, but when they see me, they're like, "Oh my God, I want to be like him. I want to run a TV station too." So I can only imagine like when you when you guys begin to hit the streets, what the younger guys are going to say, or the lives that you're going to change, not just in the rooms, but out in the street, that they're going to be like, "I want to be like you. I want to be like you, Doc." Like, it's I know it's heartwarming. I know it's awesome. I think you guys deserve a cape and an award when you walk in the streets. But man, I commend you on that, and I would love to just be there. Brandon, we gotta make sure that we see if we could get out there and film, because I think it's great what you guys are doing. And if you guys need any other help with other, barbershops in the area, I know.
Let us know.
There's a barbershop down the street, right 4 doors down. You know what I mean?
Yeah, we're trying to hit them all. We're trying to go to the most, the places where
it's
the
some of the communities are really downtrodden, where people really have the most to gain.
Those are the people exactly have the most to gain, and those are people that need the attention the most.
Absolutely, because they're not getting the care.
So how St. Francis? How what are their thoughts on it?
They've been so supportive.
Very
definitely the CEO, Brandon. He's been very supportive of this, and he's been again a huge engine in this project. So I appreciate that.
We definitely appreciate support.
If you need anything from us, you can always come back and we spread the word for you.
Absolutely.
Give you guys your own show. I don't know. Hear that, Brandon? Hear that, Brandon? They had their own show. So again, April 24th.
April 24th.
And where's the location?
287 Newcastle, Delaware, right, Lily? Yeah, 287 Newcastle, Delaware. New Creations Barbershop 2.
All right.
Yeah.
And to piggyback on that, we will be having another event. That'll be May 15th and June 5th.
Okay.
Barbershops to be announced.
To be announced. But it'll be the same event, just trying to, reach out to more people.
All right.
Yeah,
cool.
Absolutely.
If anyone wants the help, or how do they reach out to you guys?
So basically we can reach out to Lillian, or you can reach out to us. We'll leave an email.
Okay.
But we also have a flyer that we'll leave here.
Emailed you, I believe.
Yeah, I'll put the flyer. I'll make sure we put the flyer in the back of the into the video into the show, so people can see it, and in the comments as well.
Yeah,
absolutely.
Oh, awesome. All right, big time. We got a couple minutes left, but before we get out of here, if you had a message to give to a black man about his health, what would you say?
Be proactive. Be very proactive about your health, and I think that your health is your gift. You know, we're given an allotted number of years on this earth, and you kind of want to spend it in a way that you can do all the things you want to do. You can live your life to the fullest. And you can't do that if you're debilitated by chronic disease. So I think, you know, start now, start being responsible, you know, try to do the preventative things, you know, try to eat a little bit healthier, drink water, you know, do the things that, you know, you should be doing that, you know, that, you know, your mom told you to eat vegetables when you were younger for a reason, you know, he told you to exercise for a reason. Like, you know, those things are very important. And as you age, they become way more important because they keep you away from chronic disease. So that's what I would say. Yeah.
How about you, Doc?
Do what you can and take baby steps, because like there are a lot of, we understand, like we're not here trying to, you know, we understand that there's a lot of factors that go into health, and that that is more than just being able to go to the store and buy certain things. Like some people don't have the money, some people don't have the time, some people have kids at home they have to take care of. So I think it's very important that people understand. We understand that it's not always that easy, but do what you can. Take baby steps. If it's just adding fruit to your diet, do that. Yeah. If it's just adding vegetables to your diet, do that. Absolutely. Just do something. If it's just walking 30 minutes a day, just do that and take baby steps. And over time, as you start to feel better, you can just do more and more. But I think we also do understand that there are some barriers, like social barriers to health as well. But just do what you can. And I think that kind of adds to what he said as well. So,
awesome. Yeah. Love it. Doctors, thank you so much. Really appreciate you guys coming out.
You.
Really appreciate you and your success for being a doctor. Damn.
Appreciate that.
Got a little excited there. Yeah. All right. It's your main man, Ivan Thomas, one-on-one. I will see you on the other side. Be sure, again, to come out April 21st at
New Creations Barbershop. April 24th.
April 24th.
April 24th.
At New Creations Barbershop too.
9 o'clock to 1 o'clock. 9 a.m. to 1 o'clock.
9 a.m. to 1 o'clock. All right? Yeah. And when you see these brothers out there, salute them and give them some love. All right? I'll see you on the other side. It's your main man, Ivan Thomas.